Dear students, in today's video we are going to talk about the traditional part of your practical exam. So let's look at this. Marks distribution. There are three parts in your traditional exam. One is a tracing. The tracing will have 15 marks. Then drug interactions. There will be two drug interactions. You have to write down the explanations of two drug interactions, and they will contain 2 into 5, that means 10 marks. And then there will be a prescription writing. You will be given a clinical scenario and you have to write a prescription according to that scenario, so that will contain 10. So total 35, and you will be given 30 minutes time. Okay, so let's say a few words about your practical notebook. You have to use a white cover. Okay, don't let your practical notebook to be uncovered. Okay, that will look odd, and that will have a bad impression in the examiner's mind. So use a white cover. Number 2, write your particulars, that means your registration number, roll number, etc., clearly on the cover. And on the exam day you have to bring your case report as well. So this is a sample of your practical notebook, how your practical notebook will look like. Okay, cover like this, you have to use a cover. So this is a very good example of practical notebook. Now let's go to the tracing. There are two tracings. Okay, you can see dose response with acetylcholine, and another tracing is antagonism of acetylcholine by atropine. So any one of these two will be your tracing on the exam hall. Okay, so dose response with acetylcholine, that means you have to write down the relationship and you have to present it graphically. Okay, so what you have to write: number 1, you have to write the name of the experiment, that means study of graded dose response relationship by the preparation of isolated frog rectus abdominis. And you have to write the objectives as well, that means what are your objectives here. One is to observe the relationship between the dose of the drug and the response produced. Okay, and then to measure the affinity and that means the potency and ED50 and efficacy, that is intrinsic activity and maximal response of the agonist drug. Okay, so these are the objectives. Then you have to write down the calculation. Okay, now here we are using two drugs. One is acetylcholine and another is neostigmine. Okay, so you have to write down all of these calculations. Okay, all of these numbers are needed. Okay, the first the actual dose, then the log dose, and the height of contraction in millimeter. So actually you have to remember a few things, that means the actual dose, 1 2 3 4 5. You do not need to be that smart to remember these numbers. And then for neostigmine 3 5 7 9, also very easy to remember. And you will have your calculator in the exam hall, so you can easily calculate these things. That means the these numbers. Okay, you can get this from your calculator. And then height of contraction, you have to you have to memorize a few things, like the height of contractions, like 14 for 0 it is 14, for 0.301 it is 26. So you have to memorize a few numbers like this. And also you have to memorize these numbers as well, that means the neostigmine numbers. Okay, so you have to write down both these things for acetylcholine and neostigmine. Don't just write acetylcholine, because that will not show the relationship. Okay, so you have to memorize these few things. And then plotting of the curve, that means on graph paper, log doses of curve were plotted on the x-axis and the height of contractions were plotted on the y-axis. That's the thing. And then you can see the sample graph here which I have drawn. So one is for acetylcholine and another is for neostigmine, you can see. So one important thing about this graph is you know in the x-axis, this is the x-axis and this is the y-axis. So see, in the x-axis 1 equal to 50 small squares. Okay, so 50 small squares were taken for 1, and in the y-axis, sorry, so in the y-axis 1 equal to 1, right? So you can take 4 measurements, like here 1, 2, 3 and 4. I have taken 4 measurements here, and 4 measurements also for neostigmine as well. So this is the usual thing, but you can take three points as well. Okay, so at least 3 points, you have to take at least 3 points. The fourth point is additional. If you can take, then you will get more marks, but you have to take at least 3 points, 1, 2 and 3. And another important point here is not all the points will fall in this straight line. Okay, you have to add the first point and the last point. Okay, the first point and the last point, that means this one and this one, and do not try to force these points on the straight line, because that is not the thing the examiner is looking for, or that is not the real thing you will get. Okay, so just add the first point and the last point, and the other points will be around the straight line. Okay, you can see close to the straight line. This one is close to the straight line, this point is close to the straight line, and here as well, this point is close to the straight line, this point is close to the straight line. So not all the points will fall on the straight line, and do not try to force these straight lines. Another point is, if you have the points like this, for example, here is 1 point, here is 1 point, here is 1 point, here is 1 point, and do not draw the graph like this. Okay, you have to draw the graph like, suppose here is 1 point, here is 1 point, here is 1 point. Now you have to just add the first point and the last point. Okay, so these points will remain close to the straight line, not far away. Okay, so you have to just keep these things in mind. Okay, now the result, the curves for both drugs are linear. It is the mid portion of the sigmoid curve, and then you have to write the interpretation. Okay, on plotting, linear graphs were found which are the mid portion of the sigmoid curve. So responses to a drug is directly proportional to log of the concentration of the drug. The obtained curves were linear, so there is a graded relationship between the drugs used and the responses achieved. Okay, now the next graph, antagonism of acetylcholine by atropine. Same here, you have to write down the name of the experiment, that is study of drug antagonism. The objective, only one objective, that is to see the antagonistic effect of atropine on acetylcholine using guinea pig ileum. Okay, next the calculation. So you have to remember a few points from here. That means actual, that is dose, then the log dose. Of course you will get these measurements by using your scientific calculator. Then before adding antagonist, these all 50, so this is a no-brainer. And then after adding antagonist, you are getting these things. Okay, then percentage reduction, so 50 minus 37 equal to what? That goes into uh, uh, percentage. Okay, so you have to memorize a few points from here. Then plotting on a graph paper, log dose of atropine was plotted on the x-axis and percentage reduction was plotted on the y-axis. Then here you can see the actual graph. Okay, so here I have taken 4 points. Okay, these 4 points. So same here, that is on the x-axis 1 means 50 small square, and on the y-axis 1 means 1 small square. Okay, right. So and here is the percentage reduction, here is the log dose of atropine. Result, a linear graph was formed. What is the interpretation? A linear relationship is seen between the dose of antagonist and percentage reduction in the height of contraction. Antagonist binds reversibly to the receptor. Once the agonist is added, the antagonist is displaced by the agonist. So this is an example of competitive antagonism, right? Now come to the drug interactions. So you will be given 2 drug interactions and your answer will comprise 2 parts. Your answer will comprise 2 parts. In the first part you will have to state the outcome, okay, in one line, just the outcome, and in the next part you will explain the mechanism. Okay, the next part you will explain the mechanism. And you have to remember that the question carries 5 marks, so you cannot just write the outcome and expect full marks. Okay, so you have to give some details in the explanation. So outcome and explanation. So here are a few examples. Pyrimethamine, for example, pyrimethamine and sulfadoxine. Outcome, supra additive or synergistic anti-malarial action. Okay, so explanation, you can give a few points like this combination is called Fansidar. Sulfadoxine and pyrimethamine sequentially block the folic acid metabolism in plasmodia, thereby increasing the anti-malarial activity, such and such things. Okay, next you can see ketoconazole and theophylline. Write down the outcome and explanation. Phenobarbital and OCP, give the outcome and explanation. Salbutamol and theophylline, give the outcome and explanation. Same levodopa and carbidopa. Okay, you can just pause the video and you can look for yourself. Propranolol and insulin, just pause the video and see these things. Furosemide and aminoglycosides, AC inhibitors and thiazides. Okay, then metronidazole and alcohol, imipenem and cilastatin, insecticides and atropine. Okay, insecticides means organophosphorus compounds. Then rifampicin and OCP, oral contraceptive pills. Tetracycline and dairy products. Okay, tetracycline and dairy products, what happens there. Now erythromycin and theophylline. Okay, artemether and lumefantrine, right? Chlorpromazine and procyclidine, what does happen there? Tetracycline and antacid, tetracycline absorption is reduced. Okay. Tetracycline and ferrous sulfate. Penicillin and probenecid. Prednisolone and salbutamol. Clonazepam and chlorpheniramine. There are a lot of drug interactions you can see. Thiazides and spironolactone. Warfarin and aspirin. Morphine and naloxone. Furosemide and spironolactone. Digoxin and losartan. Adrenaline and lidocaine. Amlodipine and atenolol. warfarin and rifampicin, thiazides and beta blockers, aspirin and sulfonylureas, pralidoxim and OPC, organophosphorus compounds, atropine and OPC we have mentioned already, means insecticides and atropine, phenobarbital and sulfonylureas, okay, losartan and thiazides. Now come to prescription writing. Here you can see that you'll be given a clinical scenario and asked to write a prescription, okay, to write a prescription based on your diagnosis. Then you have to understand the scenario and reach a diagnosis, okay. First the diagnosis, right? So you do not need to write the diagnosis upfront, okay. You have to mention the diagnosis, where you will mention, we will show you. Then write a prescription following the correct structure. So this is the main thing, okay. You have to have your structure correct, okay. Structure is the main thing, that you have put all the things in their respective places, okay. That is the main thing, that is the thing examiners are looking for. Structures of the prescription is more important than the name and doses of drugs, okay. So sample prescription, the clinical scenario, for example, Mr. Jamal, a 22-year-old gentleman, complained of heartburn, nausea and dyspepsia. On examination there was epigastric tenderness. Prescribe a suitable drug for the patient. So here you can see that how the format is written here. So on the top left corner you will write your name, your designation, your degrees, your registration number, okay, all of the things here. This is the place where you will give your particulars. Then on the top middle part you will have your patient's name, patient's age, maybe patient's address, sex, phone numbers, etc. So these things are here, okay. And on the top right corner the date, okay. Then just under the name and the particulars of your that means your particulars, there will be the chief complaints, okay. Here you will write 1 or 2 chief complaints. For example, here we have given that heartburn after meal for 1 month, nausea and anorexia for the same duration. And just under this, the on examination, what are the findings you have gotten from your clinical examination, physical examination. So their pulse, BP, anemia, epigastric tenderness, so these are the clinical findings, okay. Then you have to give the investigations. Just under this, the investigations, that means CBC, upper GI endoscopy. So the investigations should be according to the clinical scenario. You cannot give all of the investigations. For example, for peptic ulcer disease you will not advise echocardiography, or for peptic ulcer disease you will not advise urinary, etc. So yes, CBC is a good thing because you are looking for anemia, and then upper GI endoscopy. So these things should be relevant, okay. But sorry, so these things are not the main thing the examiners are looking for. The examiners are looking for that you have put the chief complaints on their respective places, the on examination, investigation, you have mentioned all of these things. So the examiners are looking for these main points, not the they are not looking for any exact diagnosis or exact treatment. They're looking for the structure. That means the chief complaints is here, on examination, investigation, diagnosis, advice, etc. Okay. Then the treatment part. The treatment part is easy. You have to follow the pro forma. That means you are giving, for example, you are giving tablet pantoprazole 20 milligram. So you have to mention is it tablet or capsule or injection or what. So here you can see tablet, then pantoprazole, the name of the drug, then the strength of the drug. Okay, so 20 milligram, it can be 40 milligram, it can be whatever. So the strength of the drug, okay, and then the number of tablets you're prescribing. Okay, so as we have mentioned, the patient will take this drug for 6 weeks, okay, twice daily. So for 6 weeks means 1.5 months, that means 42 days. Okay, so 42 into 2, that means 84. The patient has to take total 84 tablets, so you are writing here 84. Okay, and then you have mentioned the frequency of administration, and you have also mentioned the duration of the treatment. And again, the suspension antacid, 1 file, that means the patient will take only one bottle of the preparation, then 2 teaspoon twice daily, half hour after meal for 5 days. You have mentioned that they will take the medication for 5 days, so one bottle may be sufficient. Okay, so this is in short about your traditional part of your exam. So hope you will have no problem absolutely in preparing your exam and also appearing your exam in the exam hall. Do not forget to take your own belongings, that means your pencil, your sharpener, your rubber, scales, scientific calculator, etc. And do not try to lend or borrow from your friends. Okay, so that is an odd situation. You have to take your own belongings with yourselves. So another small tip is for you, that is drawing the graph is the main part of your traditional exam, because you have seen that 15 marks for that uh, graph part. So if you write so many things in the graph part, graph question, and you do not draw the graph correctly, then you will not get enough marks to pass. Okay, but if you can draw the graph well and you do not write that many things, that will not be a problem. You will get a good chunk of marks. And for drug interaction and prescription writing, you have to write these things briefly. Okay, do not write 3 or 4 pages for 2 drug interactions. And for prescription writing, the whole prescription should be in 1 page. Okay, do not take 2 pages or 3 pages for prescription writing, it will be on 1 page. Okay, and going beyond 1 page will sabotage your marks. You will lose marks if you go beyond 1 page. So keep these small tips in your mind, and I hope you will be absolutely fine in your exam. Okay, thank you.